Dengue is a ticking time bomb in India, affecting millions and claiming lives every year. As a Grade 3 emergency recognized by the World Health Organization, dengue demands urgent attention as well as action. With India accounting for a third of global cases, it's imperative we understand the risks, the warning signs, the impact of dengue on India's healthcare system, and most importantly, the effective prevention strategies. Joining us today are experts who will help us understand the unpredictable nature of dengue and how we can build a safer dengue-free India. We have with us in studio Dr. Raj Shankar Ghosh, Lead Head Consultancy, Nangya and Companies, also former Director Infectious Diseases, Gates Foundation. We also have with us Dr. Neelam Mohan, Senior Director Pediatric Gastroenterology, Medanta Medicity Gurgaon, and also she is the President of the Indian Academy of Pediatrics for 2026. Joining us as well is Dr. Rakesh Gupta, Senior Consultant Internal Medicine, Indraprastha Apollo Hospitals, Delhi. It's really a pleasure to have you all with us, in NDTV. Thank you so much for joining us. To begin with, Dr. Ghosh, I would like to ask you, we know how rapidly dengue is increasing. In fact, it is the most rapidly spreading vector-borne disease. I think, and even, like I said, the World Health Organization, has already, has put it as Grade 3. What are the factors that why is this increasing? What is the current and projected burden of dengue in India?
Right. So thank you for this question. Dengue, as you know, is a disease which is increasing in terms of numbers that we are seeing over the past few years. There are multiple reasons for this. The positive reason is that the surveillance program in India's disease surveillance program has improved since the past many years. There is better awareness amongst the public, and therefore common people, they also insist on the testing for dengue, and therefore the numbers are being reflected. But then there are other factors. For example, with the climate change, we are seeing that with the global warming, which is also affecting India, there are certain kinds of trends in the disease that is happening, particularly because it affects the vector, the mosquito. So therefore, these are the reasons why it is increasing. Over the past many years, we have seen between 200 to 250,000 cases being reported in India. That's an underreporting. There are many more cases probably, but at least we are seeing that the surveillance is able to pick up more number of cases.
So you think it's going to pick up? But agar hum bachchon ki baat kare, Dr. Mohan, we see children are more vulnerable, right? If you can tell us what are the age-specific clinical signs, the risk factors, and when should the parents realize, or what should the parents be really looking at कि बच्चों को और मतलब seriously देखना चाहिए?
Because that's a real lot of questions. But I can start by saying that why are children more vulnerable?
Ji.
One is that the immune system is more immature. The capillaries are more thin, and you will get to know that dengue usually, affects the capillary and gives rise to leak. And the third important reason is that they have a narrow margin. For example, in an adult who has like 5 liters of fluid flowing in him, by the time, even if he or she loses a liter, which is like 20%, the amount of effect that you need to see in a shock is a large volume. But when it comes to children, they have a very narrow margin. So even if they lose a small part in a leak, that leads to a larger impact in terms of shock in their body.
Okay.
And because of the same reason, they are prone to higher risk of over-treatment and under-treatment, because the assessment in children goes relatively bad. And not to forget the very fact that children may not be able to communicate properly. An infant or a younger child less than 5 years, 10 years may not be able to say like a headache or an abdominal pain and ghabrat, or these are the words which an adult may be able to explain. So these are the various reasons why children are more vulnerable, I would say. And in addition, sadly in our country, if I look at statistics in children, the incidence of anemia, like low hemoglobin, is unbelievably high. I mean, it is 67% less than 5 years and anemic. So when you are anemic, again, that's a very high risk predisposing factor. And again, your statistics for malnutrition is higher in children. that again is a predisposing factor. Having said that, Ambika, I would like to tell the parents also, obesity is a bigger threat than undernutrition. So when I talk of malnutrition, if a child is obese or overweight,
it's the double burden,
are actually more risk for dengue complications, which, I mean, if we've ever lost children, it is majority of the time obese whom you've lost rather than the undernutrition, which is something which people can't imagine and believe in it.
I think that's a very valid point, which not too many people would know about. But Dr. Gupta, I want to ask you, अभी जैसे उन्होंने बताया कि complications कई बार severe हो जाती है. हमने देखा है 1 in 20 cases patients, you know, वो complications ज़्यादा जल्दी हो जाती है. They become severe. If you could tell us and our viewers कि ये severe dengue क्या है और कब पता हमें, when should one take that, you know, precaution or the step कि नहीं अब dengue severe होता जा रहा है ताकि we don't reach the hospital बिल्कुल आखिर में.
So I think most of us are familiar with the main symptoms of dengue which we see on a day-to-day practice. Generally fever, body ache, भूख ना लगना, nausea, पेट में कुछ पचना नहीं, weakness etc. जब यही severe हो जाता है, when the severe form of dengue, that is generally known as severe dengue. And severe dengue के basically 3 main characteristics होते हैं. There's a plasma leakage which leads to fluid accumulation. There's a severe bleeding which can happen. I think everybody is aware कि in dengue you have thrombocytopenia, platelet count जो एक टाइप का सेल होता है हमारे ब्लड में वो कम हो जाता है एक लेवल के नीचे, और जब एक क्रिटिकल लेवल के नीचे जाता है तो ब्लीडिंग होने के चांसेस होते हैं. और तीसरा, जब इतनी प्रॉब्लम्स आनी शुरू होती हैं तो एक एक करके वेरियस ऑर्गन स्टार्ट गेटिंग अफेक्टेड. अमंग्स देम लिवर गेट्स अफेक्टेड, fluid can get accumulated in the lungs, the breathlessness can come in, patient can come with symptoms like total weakness, draining out, कोई खाना पीना रिटेन नहीं होता पेशेंट को, बहुत वीक फील करता है, ड्राउजीनेस आ जाती है. और ये किस किस्म के फीचर्स जब एक्सेस में हो जाते हैं ज़्यादा, तब सीवियर डेंगी के बारे में प्रॉब्लम्स आनी शुरू होती हैं. सीवियर डेंगी इज़ एन एमरजेंसी. लेट मी पुट इट वेरी अक्रॉस. It is a emergency, it's a medical emergency. A severe dengue has to be treated on a very, very critical way, and lives can be lost अगर हम severe dengue को ठीक तरह ट्रीट नहीं करते. So ICU में पेशेंट जाएगा, उसका प्रॉपर ट्रीटमेंट होगा, उसको फ्लूइड्स मिलेंगे, कॉम्प्लिकेशंस बहुत ज़्यादा होते हैं. और डेंगू वैसे आमतौर से आम आदमी की थॉट ये है कि इट्स अ सिंपल कंडीशन, थोड़ा सा ध्यान रखने वाली बात है, विच इज़ ट्रू इन मेजॉरिटी ऑफ द पेशेंट्स. लेकिन 1 to 2% पेशेंट्स कैन हैव सिवियर डेंगी leading to death also. So case fatality rate भी इसमें होता है generally. So one has to be aware of that. कब patient ऐसा ख्याल करेगा कि सीवियर डेंगी होता है, probably आपका जो फैमिली फिजिशियन है या जिसको आप रेगुलर दिखाते हैं, he is in a better position to pick it up. So कोई भी बुखार जब 1-2 दिन से ज़्यादा होता है या ऐसे सिम्टम्स आने शुरू होते हैं, immediately contact medical help, contact your family physician or doctor, or rush to the emergency of the hospital, and there they are much geared up to pick up these things and treat the patient properly.
So one has to be very aware and keep looking out for those symptoms. In fact, Dr. Mohan, मैं वही आपसे सवाल पूछना चाह रही थी, सिंस डॉक्टर गुप्ता ने इतनी अच्छी तरह समझाया कि व्हाट इज सिवियर डेंगी, ताकि वो हम मिस ना कर दे कहीं साइन सिम्टम्स को. बच्चों के केस में मैं स्पेसिफिक पूछना चाह रही हूँ कि आपने पहले कहा था इट्स डिफिकल्ट फॉर चिल्ड्रन टू कम्युनिकेट. तो व्हाट आर द अर्ली साइंस जो पेरेंट्स या केयर गिवर्स को देखना चाहिए कि हाँ बच्चे का केस अब सिवियर हो रहा है?
Exactly. So it's quite different from he was talking. Suppose imagine if I have a baby who's less than 1 or 2 years. Then in that case the symptoms are very different. The child may refuse to feed, irritable, lethargy, crying. These could be and the skin will get cold. But the typical blue spots etc. which you see in adults may not be typically seen in very young children. So that is the time that so one myth I want to burst is a parent बड़ा खुश हो जाता है जब fever down हो जाता है. So they feel very relaxed. Oh, my child's fever has come down. It was so high grade. That is the time when a doctor gets actually worried, because in dengue the leak starts not in the first 48 to 72 hours. It's predominantly when the fever goes down. That is the time the leakiness increases. So to me, the message to my parents is that when the fever goes down, at that time, if a child is irritable, sleeping excessively, drowsy, lethargy, or vomiting, the vomiting are more than 3 in an hour, or maybe 5 in a day, urine output is not passed for 6 to 8 hours, not past urine, and the skin appears cold despite no fever, these, and the tummy feels blowing, or the pulse rate, the parents also can feel the pulse rate is getting faster and the child is little drowsy and lethargy and weak. These are the signs which is very worrying to me. Of course, if a child has bleeding in the gums or in the urine or stool or nose, then needless to say that it is severe. So the myth which I want to burst is, number one, if fever goes down, everything is sorted. Answer is no, because that is the time the severity warning signs are there. Number two, platelets are what I want to chase, because parents call you ki platelets to abhi itne hi hai. But the truth is, it's not the platelets I'm worried. It's about the thickness of the blood. So I call it hemoglobin or the hematocrit. So that is what needs to be emphasized through social media like you, that it is not always the platelets that we should chase, but we should chase the hematocrit, because they find it, and any child whose liver function is deranged in any blood test more than 2 times, I think these children are very much at high risk. They should be definitely under a medical care, because you never know when a child slips quickly
and when it becomes,
shock.
from regular, what you think is regular, it becomes severe. Well, on that note, we're going to be taking a very short break. When we come back, we're going to be talking at solutions and preventions of dengue. Welcome back. You're watching Fight Dengue, Mission Towards Zero Dengue Deaths. Dr. Ghosh, now we know the signs, we know the symptoms. When we know if it's a severe case, what to do, when to go to the hospital. You did talk about climate change, and we see that trend, that how we see dengue now literally through the year. Earlier we thought it was just during the monsoons. मैं आपसे पूछना चाहूँगी, what adaptations are needed in public health strategies ताकि जो ये changes हो रहे climate change में हम इनको address कर सकें?
3 चीज़
जी.
फर्स्ट है कि प्रोग्राम के बारे में, प्रैक्टिस के बारे में बात करेंगे और पॉलिसी के बारे में थोड़ा बात करेंगे। प्रोग्राम्स में हमें फर्स्ट ऑफ ऑल जो डिफरेंट डिपार्टमेंट्स है गवर्नमेंट के, जैसे मान लीजिए एजुकेशन डिपार्टमेंट, हेल्थ डिपार्टमेंट, एनवायरनमेंट डिपार्टमेंट, ये सारे मिनिस्ट्री के एक साथ काम करना है। इसके लिए उनको क्या चाहिए, एक जो डेटा जो अराइज होता है वो डैशबोर्ड, कॉमन डैशबोर्ड होना चाहिए, जहाँ से ट्रेंड को समझ में आए कि कहाँ नए एरियाज़ है जहाँ पे डेंगू फैल रहा है। द सेकेंड थिंग होना चाहिए कि पीपल के एजुकेशन के बारे में, जहाँ पे नई एरिया है, जहाँ पे कभी डेंगू हुआ नहीं है, वहाँ पे लोगों को उतना जानकारी नहीं है, तो वहाँ पे वी विल हैव टू सी दैट the people are educated about how to protect themselves, like in the clothing, because warm climates may people kind of put off their clothes and all of that when they are sitting outside. जब बाहर बैठते हैं तो उनको वो होना चाहिए कि they are properly covered and all of that. And the third is this vector control measures जो हम लेते हैं उसमें हमें integration होना चाहिए, so that the integrated approach जो हम करेंगे गांव में and सब जगह पे, there is a better coverage, there is a better kind of outcome of this entire integrated. So at the level of the people's practices, at the level of the program, at the level of policies, we need to bring some changes.
So I think at all levels changes need to be brought in, all the stakeholders need to work together. Dr. Gupta, आपने बताया, we need to know when the case is severe, and we do see, and I think personally all of us at some point have seen, the pressure on the hospitals, the healthcare system. अगर आप हमें बता सके जो rate of dengue कितना है adults में, obviously we know it's going up, but and how much during that time, how much impact does hospitalization of the number of increasing dengue cases have on our healthcare system?
Dengue has come into our lexicon for last 20-25 years.
Yeah.
उसके पहले हमें डेंगू के बारे में ज़्यादा नॉलेज नहीं था, बट अब हम देखते हैं सीज़न कर के डेंगू हमारे रेगुलरली आने लग गया बेसिकली। जब डेंगू आता है तो काफ़ी रश होता है, पीपल ऑल्सो दे पैनिक भी होता है लोगों में, लोग प्लेटलेट्स भाग रहे हैं, प्राइवेट लैब से लोग अपने टेस्टिंग करा रहे हैं और खुद ही डिसाइड कर रहे हैं कि क्या बात है क्या नहीं है। एक डॉक्टर नीलम की एक बात मैं ज़रूर और बात करूँगा जो उन्होंने की थी, प्लेटलेट्स तो चलो एक इम्पॉर्टेंट चीज़ है, लेकिन एब्सोल्यूट प्लेटलेट इतना इम्पॉर्टेंट नहीं है जितना प्लेटलेट, सीरियल प्लेटलेट काउंट वो ज़्यादा इम्पॉर्टेंट है। अगर किसी आदमी का प्लेटलेट अच्छा भी है लेकिन पहले से बहुत ड्रास्टिकली कम हुआ है तो वो भी एक पॉइंट है कि एक बहुत एमरजेंसी है कि हमें इसको देखना चाहिए। सो बेसिकली एक और चीज़ जो मैं ज़रूर बोलूँगा अपने सब व्यूअर्स को कि खुद ट्रीटमेंट मत करें आप। एक एस्पिरिन या ब्रूफेन या ये जो NSAIDs कैटेगरी की ड्रग्स होती हैं जो आमतौर से लोग ले लेते हैं इतने कॉमनली, डाइक्लोफेनेक, ऐसा मत लीजिए। इससे बिल्कुल नहीं, बिल्कुल द ओनली सेफ मेडिसिन इफ एट ऑल आई कैन से इज पैरासीटामोल, जो हम सब फेमिलियर हैं। उतना तक अपना आप ट्रीटमेंट कर सकते हैं, इसके आगे प्लीज़ सीक मेडिकल हेल्प। ऑब्वियसली जिस पेशेंट को एडमिशन की ज़रूरत है उसको ज़रूरत है, जिस पेशेंट को ऑब्जर्वेशन की ज़रूरत है उतनी है, तो आपका जो डॉक्टर है वो आपको शायद गाइड करेगा बेटर पर से। लेकिन पैनिक करने वाली कोई बात नहीं है, लेकिन ज़रा सा सिचुएशन ऐसा लगे जिसमें पेशेंट को प्रॉब्लम ज़्यादा हो रही है, देन डोंट डिले इट। दिस पेशेंट शुड बी ट्रीटेड बाय अ यूनिट विच इज़ वेल वर्स्ड विद इट, और वो आपके सबसे अच्छा केयर कर सके।
So now that we know the severity, we know
I'll
it could have
add one more
complications.
point on to that what I say is because the margin of safety is small in children. So number one, we always say paracetamol to be used. Number two, I would say that if the child is vomiting and urine is less, it's good to use the WHO ORS at that time, because by the time you reach a center, it is better to use sips of ORS so that some fluid is getting into the body. And at the same time, it is also very important to go to a place where there is facility for pediatric care, you know, because these children may need ICU care also. So you have to, it's the treatment of dengue is not something magic, but what we have been able to teach to all the doctors now uniformly is about the fluid management. So for this fluid management, it is better to go to a place where there are people who are understand the pediatric management relatively, especially if the child is smaller. That's the message.
So it's key, to go to the right place. I think
Right
that's
place. But
specifically
when you
for
think there
pediatric
is
care.
something like in tier 3 cities where you
Yeah.
lack, then by now we professionals are making efforts to educate them and how to treat children.
In fact, that's
so
going to
that
be my
there
next
is-
question to you and about educating and how we can take that even further. Dr. Ghosh, of course, we know dengue is an issue. We know the cases are going up. I want to ask you as a solution. In fact, India accounts for 1/3 of global dengue cases.
Right.
In 2024 itself, there were 297 deaths,
Yes.
a number we can't ignore and say, it is a serious problem. So what policy measures and infrastructure investments are needed to strengthen dengue prevention and control efforts in India? Specifically, I ask you as a prevention, but more as a solution based, right? Yeah.
So, three things. One is that the access to diagnostics and treatment must increase, that the vulnerable population particularly, they must have better access to treatment. The second is that, as I said, there must be a very strong intersectoral kind of cooperation between the education department, health department, so that people are made better aware of this. And the third thing that we need to do is we need to ensure that the various kinds of vector control measures that are being taken as a policy, they need to really infiltrate down to the villages and to the areas where it is most vulnerable. There we need better investment and also capacity building of the health workers so that they can do a better job. So investment not only in terms of the fiscal investment, but also investment in our health workers training and all of that is a very, very important step.
Okay, so we
And
need
breaking myths, as we are very well discussing amongst the population, is
so
very
more
important.
awareness, like I think
Absolutely,
community
absolutely.
awareness should be there. Dr. Gupta, would you like to add anything more as a solution base when we're looking at dengue for prevention? From that perspective.
I think sanitation is the biggest thing.
I think that's a very
I
valid
think
point.
if we have a good sanitation system all around, we can take care of majority of the problems per se. After all, dengue होता कब है? ये जो वायरस है और ये जो mosquito borne diseases होती हैं, they are because there is a collection of water somewhere or there is a poor sanitation somewhere, and because of traveling happening so often and like climate change, urbanization. So I think we really need to be aware of the fact that sanitation is the basis of cleanliness per se. But अगर किसी को डेंगू हो ही जाए, अगर हो ही गया basically, then of course treatment has to be fast and rapid. And like I say again and again, please don't treat yourself beyond a certain stage.
I think that's a very valid point. Lastly, I know we're running short of time. Dr. Mohan, अगर आप कुछ ऐड करना चाहेंगे more from the community awareness
Yeah.
perspective and public awareness, कितना important है to prevent dengue?
Right. one thing is that why is dengue getting more severe? Because he said we've been seeing for 2 decades. Whenever you had a past dengue infection, especially in children, the second infection is going to be more serious. And I mean, the reason is because you have antibody against one serotype and there are 4 serotypes. So the second infection is more severe. So they should remember कि पहले भी हो चुका है, हल्का था, तो second time can be more severe. Second message I want to give to parents is a 10-minute check weekly. 10-minute check weekly means every week. It's not that dengue season में ही आपको काम करना है. Throughout the year, you have to increase awareness of the community. When I say community, it means not only the government health sector involvement, the professionals teaching to them, and in the ASHA workers, A&M workers, when I talk, the community leaders, RWAs, and the individual, the parents who need to work on the 10-minute check. And the people should say कि अगर मेरे घर में कुछ भी है, how do you bother? Because if I do not do a 10-minute check and I have bucket of water, sanitation, cooler,
so make sure कि मतलब
then
taken,
he is also exposed to risk because he is my neighbor.
And that's the
So
basic
that is how
responsibility as
the
well.
responsibility needs to be collective.
Thank you.
And a message to the parents is children are more vulnerable. You will not realize the symptoms go more severe. So you need to go to ask for this and you need to work for prevention. And the prevention strategies could be the TV media and the social media and all. We need to work together because it's only a andolan which can prevent.
Absolutely. And thank you so much, Dr. Ghosh, Dr. Mohan and Dr. Gupta for joining us today in this critical conversation. So dengue isn't just a seasonal threat. It's a challenge that demands consistency, awareness and collective responsibility. The insights you heard today aren't meant to alarm, but to empower. Because the more we understand this disease, the better we can protect ourselves and our communities. As we wrap up, remember that simple preventive steps, timely medical attention and community-led action can save lives. Stay informed, stay vigilant, and let's work together towards a healthier, dengue-free India.